Are you concerned about the coronavirus? So am I. Let's talk about it. Welcome back to the Big Rand Show. Thank you for joining me. If you could, hit that subscribe button down below, and let's get right to it. Now, coronavirus. A lot of people are talking about it. The media is all up in hysteria over it. And here I am trying to figure out what's fact and fiction. Now, first off, I want to cover that meme that went out saying that they had found a cure for it and a vaccine. They haven't. Now, I don't want to cause any fears, but I just want to let you know that that was fake and that that was not true. Second, coronaviruses do exist within humans. Now, it's rare for them to, but there are 7 that scientists know of that can infect humans, including 2 more recently discovered ones, SARS and MERS. Both, these are respiratory illnesses that could really wreak havoc on the human population. Now, I don't believe there's as much to panic about right now as the media is letting on. The media is sitting there working people up into hysteria over this, and let's get to the numbers, shall we? There have been 2,700 cases in mainland China, and that number is most likely going to get bigger and bigger. Now, the fact is, out of that 2,700, though, 80 people have passed away, and that is tragic, but it could be worse. We're not talking like an Ebola type outbreak where you get 5,000 or 6,000 dead, right? Or a measles outbreak like they had in the Congo that killed 6,000. But it's still something to be concerned with because they're worried that it's just in its beginning stages, and as it spreads to more people, as it picks up steam and it gets stronger, that it could, mutate and become a major killer of the people that contract the virus. Now, there are some things you can do to help yourself out here, to prevent yourself from maybe contracting said virus. First and foremost, really, wash your hands. Keep your hands clean. If you go to the store, you push a shopping cart, use some Purell, grab the Purell wipes that they have there at Walmart, wipe down wherever you're going to be touching that cart. If you're going to put your kid inside the cart, I suggest taking that Purell wipe and wiping all the way on the inside of that seating area. And just, that's just a simple precaution. And be sure you keep, maybe keep Purell, some other hand sanitizer on you at all times, especially if you work in the public. As well, if you're around a lot of people all the time, my other suggestion would be a face mask of some sort, like a medical mask, like a doctor would wear. Now, I'm not suggesting you go buy that 99-cent box down at the Dollar Tree, but if that's all you can afford and you feel you need to use that, then by George, go down to that Dollar Tree and pick them up. Maybe you can find some better ones over on Amazon or on Walmart, Rite Aid, CVS, something like that, right? Maybe Walgreens. But the fact is, it has not killed that many people as of now. So this media frenzy saying panic, panic, panic is... You don't need to panic just yet. You need to take precautions. Panic is just something I don't advise. Now, I am one of those people that I'm very fearful of these kind of things because a respiratory illness like this could kill me in days. And I live in fear of that every flu season. So trust me, I understand your fears and understand that you're scared. I understand that a lot of people are scared. But I want to let you know, don't let the media drive your panic. Okay? The media does this all the time. They work us up into a frenzy over stuff, and then there's nothing to it. Now, 50 people have had confirmed cases outside of Japan in 13 different countries. I believe 4 of those, maybe 5 of those have been here in the United States. And they're figuring there will be some more. But as of right now, none of the people in the United States with it have passed away from my knowledge. Now, Japan... has a few. I believe it was. I think I saw 7 was the number last I saw for them. I'm not sure if that's accurate or not, but there are a number of countries with a few of these cases, totaling 50. As well, China has been trying to prevent the spread of this illness, but they've kind of screwed up because they've put 60 million people on lockdown, and 11 to 13 different cities in China in that province have been locked down completely around the epicenter of that outbreak. Now, the problem is, and this is what scares me, is that this virus can be spread without any symptoms, meaning no fever, no nothing. From the moment that you contract it, your body is sloughing that virus off for other people to catch. And unfortunately, that's a problem because they've been letting people get on planes and travel across the globe, and they've been allowing people to travel within China without having a fever. If you didn't have a high fever, they let you go. But now I think they're probably going to lock down even harder in China, and they're probably going to start shutting stuff down. Now the thing is, China's in a special spot here because we don't talk about, the one thing that they don't have there is civil rights. What the government says goes, period, right? So they're in a spot where they could easily contain this better than they are, and hopefully they continue to do so. But like I said, this isn't something to panic about just yet. When you start seeing lots of people getting into the U.S., then maybe be more concerned. But right now, my suggestion is to be calm, rational. Don't panic. Just take precautions. And if you have the flu or any other kind of illness, or you think you might be coming down with symptoms of the coronavirus, stay home. Don't go out in public. Don't risk the public's health. All right? This has been the Big Ranch Show. Thank you for joining me. Like I said, don't be scared. Don't panic just yet. Don't let the media work you into a tizzy. And I'll bring you more information the more I have it. Anyways, thank you for watching. If you could, check me out on Patreon. I have some new videos over there. $1 a month gets you 2 videos exclusively a month and some other posts. I plan to move this to 4 or 5 videos a month if I could just get more subscribers over there. Anyways, thank you for watching, and just stay healthy, America.